Hi, I'm James Stuckey. In part 1 of this video, you learn about the primary spinal surgery objectives and common spinal surgery approaches and procedures for degenerative pathologies. In this video, I will finish up with minimally invasive and maximum access procedures, corpectomies, and total disc replacements. First, I will discuss minimally invasive procedures, or MIS, beginning with MIS TLIF. The MIS TLIF approach allows the lumbar spine to be accessed through a small incision in the back, with muscle dilation gently separating the muscles surrounding the spine rather than cutting them, allowing minimal disruption of the muscle and soft tissue. This type of procedure typically uses fluoroscopy and/or other image-guided technology to identify the bony anatomy during surgery. The minimally invasive PLIF procedure allows the lumbar spine to be accessed through one smaller midline laminectomy-style incision, which preserves the multifidus innervation. Medial to lateral pedicle screw trajectory is utilized with this approach. This type of procedure typically uses fluoroscopy and/or other image-guided technology to identify the bony anatomy during surgery. As with any procedure, there are pros and cons. A few of the positives of MIS TLIF and PLIF procedures include minimal neural retraction, muscle and soft tissue preservation, and decreased blood loss. Challenges include a steeper learning curve, limited exposure to landmarks, and potentially increased OR times. You will notice that while minimally invasive spine surgery is typically denoted MIS, Nuvasiv's minimally invasive procedures are branded MAS, for maximum access surgery. Traditional MIS surgery has the reputation of requiring unconventional visualization through confined tubes with specialized and small instruments. Again, a surgeon beginning to adopt MIS may experience a steep and long learning curve before they are proficient with the operation. In the past, many surgeons did not adopt MIS because of these reasons. Nuvasiv's MAS procedures are differentiated from traditional MIS procedures in several key ways. MAS procedures use conventional visualization and instruments that surgeons are accustomed to using in open procedures. This significantly reduces the learning curve of MAS versus MIS. MAS procedures, like MIS, offer minimal tissue disruption with the potential for faster patient recovery. Now, onto our lateral lumbar approach procedure, XLIF. XLIF stands for Extreme Lateral Interbody Fusion. It is an innovative approach to the spine fusion, accessing the spine from the side of the body instead of the front or the back like traditional methods. The spine can be approached from T4 to the L4-5 disc space in the lower back. This side entry means that sensitive back muscles are not disturbed and no bone removal is required, resulting in less postoperative pain and early return to normal function. The positives with this approach are numerous and far outweigh its few challenges. Pioneered by Dr. Luis Pimenta, XLIF was first brought to the market in 2003. Through continued innovation and the integration of Nuvasiv's proprietary neuromonitoring, customized access, application-specific interbody portfolio, and over 400 peer-reviewed publications, Nuvasiv is the undisputed market leader in the lateral approach surgery. We will dive much deeper into XLIF and our lateral approach solutions in future training modules. Switching topics, I will briefly discuss corpectomy procedures. A corpectomy is a surgical procedure to remove a vertebral body, usually to decompress the spinal cord. In this surgery, the vertebral bodies and adjacent vertebral discs are removed to alleviate the pressure on the spinal cord, which are causing spinal stenosis and/or myelopathy. A cortical bone graft strut or mechanical cage packed with bone graft is then inserted into the space to allow for a fusion of the bone into one long segment of bone. This procedure is then augmented with lateral or posterior fixation for stability. The procedure can be used to treat some fractures, tumors, infections, or spinal deformities. Corpectomies can be performed in the lumbar, thoracic, or cervical spine. Positives of corpectomies include decompression, restoration of coronal and sagittal alignment, anterior column stabilization, and fusion. Some challenges include a large incision resulting in high blood loss, rib resection, and ipsilateral lung deflation. It is possible to stabilize a segment without fusion through a total disc replacement procedure, or TDR. TDR is a surgical procedure involving removal of a damaged or degenerated disc and replacing it with an artificial disc device to deliver pain relief and maintain mobility at the particular segment. During this procedure, it is still important to decompress the neural elements, increase disc height and foraminal height, correct and maintain spinal alignment, and the device itself must fuse to the bones for long-term fixation. And that's it. You now know about the primary spinal surgery objectives and common spinal surgery approaches and procedures for degenerative pathologies.